You may not have heard of Hashimoto's before, so let's see what it actually is. Hashimoto's is an autoimmune disorder in which the immune system attacks the thyroid. Do not confuse it for simply an underactive or overactive thyroid. With Hashimoto's, the thyroid is not stable and may be underactive or overactive and can even be normal during periods of remission. So why is the thyroid so important? The thyroid, often called the butterfly gland due to its shape, is part of the endocrine system and through hormones aids or controls almost every function and system of your body. Just to name a few ways it impacts your body, it produces T4 and T3, which are hormones of the thyroid, which aid in the control of metabolic rate, heart function, muscle control, brain development, and digestion. What causes Hashimoto's? It starts with the expression of thyroid-specific autoantibodies against thyroidal antigens leads to infiltration of immune cells in the thyroid follicles, resulting in their destruction. Hashimoto's is a T helper cell-mediated autoimmune disorder. Cytotoxic immune cells destroy thyrocytes by induction of apoptosis. Oxidative stress is also a factor leading to further damage of the thyroid over a patient's lifetime. Some patients have been put on antioxidant-rich diets in hopes that it will reduce the damage. People affected have some history of thyroid issues and autoimmune disorders in their families, most commonly on the mother's side and passed to the daughters and rarely to sons. Hashimoto's is normally triggered by some form of trauma to the body, in my case a massive internal infection brought on by a birth defect that needed to be surgically removed. It is most commonly accompanied by other health issues or disorders like eczema or arthritis. Being diagnosed can be a long process because little was known until recently, and it used to be thought of as nothing more than just an annoyance, but new findings are showing that there is a link between fibromyalgia and Hashimoto's. Multiple studies have shown that there are antibodies linked to Hashimoto's found in people diagnosed with fibromyalgia, more often than in the general population, even among those who don't have low thyroid hormone levels. Symptoms include, but are not limited to, weight gain, hair loss, chronic pain, chronic fatigue, hormonal imbalance, gastrointestinal issues, depression, inability to conceive, pale and/or dry skin, increased temperature sensitivity, muscle weakness, memory lapses, and brain fog, anxiety, issues with the heart such as erratic heartbeat, and a feeling of choking. Late-stage patients can develop thyroid cancer, goiters, or masses on their thyroid known as nodes. The way it is treated today is often by drugs to replace T4 and T3, which only help symptoms. Patients are often told to take Synthroid until the thyroid becomes damaged enough to be removed, which causes other issues. Hopefully, this new treatment will give people suffering from this illness a brighter outlook.
PTX, pentoxifillin, also known as oxypentafillin, is a generic drug used for medical purposes to reduce pain, cramping, numbness, and/or weakness in arms or legs. These symptoms result from what is called peripheral artery diseases. Medical scientists are saying that PTX is the new best drug. It can alter the nature of Hashimoto's to prevent the spreading and advancing of the disease. It decelerates the cell-mediated autoimmune destruction of thyroid sites during HT. It increases the sensitivity of thyroid sites to TSH. The regeneration and redevelopment of thyroid tissues is a plus. It decreases the switching of Th17 cells towards Th1 cells, decelerates infiltration of leukocytes, decreases and postpones fibrosis of thyroid gland during HT, and ameliorate effects of TSH on thyroid sites during HT. With PTX on the rise, patients that are currently taking many pills and supplements to combat and deal with Hashimoto's can now look to something positive. This medication would in fact eliminate or reduce the amount of pills taken on a daily basis. Another plus is the reduction of side effects that allow for safer treatment options.
In this section, we're going to discuss how to determine whether a thyroid test is working. One common method using biotechnology to test thyroid antibodies is called a chemiluminescent immunoassay, or CLIA for short. A brief summary is as follows. Samples are first collected through a biopsy of the thyroid or blood using an ultrasound-guided needle. The collected samples are then tested for their absorbance through CLIA. This assay will measure the antigen or antibody in the sample by tagging the analytes, and the emitted light represents the concentration. Here, we see a more detailed explanation on how the system works. First, specific capture antibodies are used to pre-coat the surface of a microtiter plate. Then, the samples that were collected through the biopsy are added to the plate walls. This will bind the analytes that are present to the immobilized antibodies.